Happy Mother's Day, everybody, and welcome to another wellness weekend. My name is Kathy Reneses. I am the in-house life coach at Centro Holistico, and joining me today is one of our lovely Centro Holistico doctors. This is Dr. Venice Valdez. She is a integrative and functional medicine practitioner and also a medical consultant. And I just love seeing her whenever I pop by the Pasig Center, whenever I happen to be there. Hi, Ven. How are you?
Hi, good morning, Kathy. Good morning to all the mommies out there and kahit non-mommies. Hi. Happy Mother's Day. Hope you're having everyone's having a good Sunday so far.
Yeah. Do you have anything planned for like your mom, your Mother's Day? Are you guys doing anything special over there?
Yeah, so we're five siblings in total and we're gonna be cooking dinner tonight. So wish us luck. Yeah, wish us luck.
You've got all the stations covered.
Yep.
Let's
One
let
dish
us
per
know.
kid. Yeah.
I love that. And that sounds extra special. I bet your mom is going to be super pleased. Um,
Hopefully. Cross
the
fingers.
yung maglilinis ng kusina, probably not so much.
Kami rin eh. Kami rin eh.
So it really is act of love talaga,
Yep.
no?
Yep. For today. For today. What about
Cooking and
you?
decorating. I'm just having a quiet weekend at home. My mom doesn't live with me. But I am making the most of all these Mother Day promos that are happening.
Okay.
So yeah, that's I'm a fur mom, I guess. So that's what I'm treating
Yes,
myself
yes. Yes,
to.
you are. Happy Mother's Day also to you, to all the parents. That's what we call you
Any
guys, right? Parents.
exactly, like any excuse to celebrate, like I'll take it.
That's good.
So
That's fun.
then we're having a very this is a very interesting topic, no, for this weekend, and it really is we're talking all about women's health.
Hmm.
Um can you just kind of explain for all of us like why women's health, like why we should be concerned about like this specific type of health?
Okay. Yeah. So, I mean, we're doing a lot of things all the time. Women are multitaskers. We're better
Mhm.
multitaskers than men are. It's a fact. There are studies behind it. And
Mhm.
so, we have to take care of our health. A lot of the studies kasi out there that are published are also based on men's physiology. And not to say that it's bad or good, it's just that,
Yeah.
we just have to look into the science of specifically women's physiology, biochemistry,
Yeah.
cellular, molecular, whatever studies,
Mm.
ganyan. Kasi nga, our needs are different from men, right?
Yeah.
Oh, so and then the amount of things that we do also differs from men. We also have different intentions, different dreams for ourselves also. So we need, no, we just need to focus on those things that can help us
Mhm.
optimize our health, especially
Yeah.
since we also go through different phases of reproduction. So even even at when you were in your mommy's tummy, your reproductive system has already been developing there, and then you go through that period of childhood, puberty, which is a
Mm.
transitionary period, and then you go through the phase of adulthood, and then after adulthood, that fertility phase.
Mhm.
You go through perimenopause, then menopause, and then a phase where it's just a lot of hormonal changes as we go through life, and we
Yeah.
have to we just have to be mindful of that. It's not necessarily ano ba, a curse,
Mm.
like for some of us might think, or like because we do menstruate every month, diba? And
Yeah.
sometimes, most of the time, we think of it as a hassle, but there are ways for us to lessen the symptoms that we feel every month, and even
Mm.
guide us through the transition phases in our lives. So
Yeah.
yeah.
That's interesting. So like from a functional medicine perspective, since everyone I'm at Centro is a functional
Yeah.
medicine practitioner, At what age should we start to be concerned about women's health? Because like what I experience usually is I go to my OBGYN,
Mm-hmm.
and I would like ask for a pap smear, and she'd be like, "Oh no, you're too young for that. You don't need to worry
Mm-hmm.
about your women's health till you're like in your 40s." So yeah, do we have any unique health concerns that we should be mindful of during different stages in our lives?
Well, actually, so that's a good question. Kasi 'di ba parang we only focus on puberty onwards, but
Mm,
really there's an effect on our reproductive health even when we were, when you're younger, when you're during your childhood days. So what, like, from a functional medicine perspective, 'di ba? I know you've been discussing this for the past wellness weekends with other doctors and with me also from the very first one that we did. Na um, everything that we do on a daily basis, the things that we eat, how we sleep, how we move, how we're handling stress, and how our relationships are going has an effect on our health and all of the systems all around.
mhm,
So just imagine, like, what are the habits? Yeah, that's one thing. What are the habits that no parang you saw or you developed growing up, 'di ba? Like, how were you eating when you were younger? Because
mhm.
some kids or some teenagers have issues already, and it doesn't naman start from the day that they were diagnosed. It actually
Mm,
starts way before that, kasi parang some of them have delayed periods or some of them have early periods, and those have
yeah.
really root causes. Then those have a lot of background information that we need to look into. So yeah, so to answer your question, as early as childhood, basically. Yeah. And even actually when you were born, like how you were born, because, we talk a lot about your gut microbiome, and that also has an effect on your reproductive system.
Got it.
PCOS, yeah. So PCOS is one, right? That's
Mm,
one common health concern that we get, that comes into our clinics. And that also has an effect. One of the causes there is also an imbalanced gut microbiome or dysbiosis, basically.
got it. So so you're telling me, like, for example, if if my diet wasn't as balanced as it should be, like growing up, for example, if I all I did was eat, I don't know, like French fries and chicken nuggets, that would basically affect like when and how I would get my menstruation. Is
Mhm.
that on? And then
Yeah.
all the way up to menopause, it still
Mhm.
affects that.
Yes. Yeah. So
Wow.
yeah, just imagine like you were parang building a foundation that is inflammatory. Tapos
Mm,
it's worse pa, or not naman worse, but if you do have that genetic predisposition towards an inflammatory disease, then
mhm.
what you just have to ask yourself, okay, what is my environment I'm bathing my genes in, right? Kasi
Mhm.
yun nga, all of these hormonal issues can be also tied to inflammatory processes as well.
Got it. Okay. So since we're talking about menstruate, usually when it comes to like women's hormones, like that's the first time that we notice a big change in our body when it comes to
Mm-hmm.
women's health. How does this menstruation, menstruating monthly, does that affect women in any way? I read somewhere that menstruation is actually like a form of detox, which is why women outlive men. So can you, like, is there any truth to that, or is that just a myth?
So I'll circle it back lang muna. So I will answer that question. Marami lang mga tangents.
Tara,
Um,
let's do
so
this.
with, so with with any kind of hormone, 'di ba? Kasi whenever we're thinking of reproductive system, we're thinking
Mm,
mostly about hormones, but that's just one part. But
yeah.
anyway, just starting from hormones, you have to think of four things kasi, and we call that PTSD. So number one, how are you producing your hormones, or how is your body synthesizing hormones? Number
Mhm,
two, how is it transporting? Kasi, okay, you're producing hormones nga, but then is it going to the places where it needs to go, right? Number
mhm,
three, yung S is sensitivity. Sure, you're producing hormones, the transportation is good, but is
mhm,
the organ that is specific for that organ able to receive it properly? So yung cell sensitivity of that organ.
Mhm.
Tapos, number 4, the D, PTSD, detoxification. So, are you able to detox hormones? Are you able to detox waste products? Because hormones, kasi once they're done doing their job, they turn into waste materials also. So, you
Okay.
need to be eliminating those. Otherwise, it's going to recirculate and it goes
Mm.
to the areas where they have receptors too. So, even though kung our estrogen, right, we think of our ovaries or our uterus, ganyan.
Yeah.
There are also receptors in our breast, in our bone, in our brain.
Okay.
So, yeah. So, if, imagine circulating waste materials and it goes to those
Yeah.
areas, then it can create yung mga, ano na, um, parang uncomfortable symptoms.
Mm.
Yeah, yun.
Okay.
So, did I answer your question?
Well, like so in terms of menstruating monthly, this
Oh,
is
right. Yeah.
basically like us getting rid of our waste because, we weren't able to use the whatever was
Yeah.
there,
Mm-hmm.
etc.
In a way,
Um,
yes.
yeah. So my question was like, is the whole menstruation as a form of detox, is that like a myth, or is there some fact in that?
Well, if you look at it from the PTSD, then yes, there's a factor of detoxification, but it's not just
Mhm.
detoxification, right? It's also
Yeah.
how your hormones are balancing, how, like, kasi diba there are women who have hormonal issues, like
Yeah.
they have prolonged bleeding, and
Hmm.
that's not always a healthy health concern, right? So, um, to say that it's a form of detoxification, yes, but if you are menstruating more than usual, or you're not menstruating at all, or your periods are, skipping,
Yeah.
then we have to consider other things also. Maybe it's no a detoxification issue, or maybe yun nga, the production issue, or maybe transport or sensitivity, etc. Or there might be other things that might be pushing your menses to be prolonged or to
Mm.
be shortened, ganyan.
Got it. Okay. We have a question here from Ma'an. She says, when I was still in the reproductive age, I was suffering from endometriosis and I'm sorry, how do you say this? Ad-
Adenomyosis.
Adenomyosis.
Yeah.
Both my daughters have now been diagnosed with endometriosis.
Mm.
What is it that can be done to reverse it, or is there any treatment other than getting a hysterectomy?
Oh, that's a good question, actually. So, this is a good question because it shows how there might be a genetic predisposition. Maybe you should ask
Mhm.
your mom also, or your other female relatives also, if they have had issues. So that's like one antecedent that you have, or one
Mhm.
factor in your health, right? But you have to ask also, and this is something that we can discuss then. What are the things that might be triggering this inflammatory process in me and in my daughters, right? So going back lang to those 5 modifiable lifestyle factors, how are they eating? Are they moving every day? How is their sleep? Are they stressed, or how are their relationships going? Social interactions, etc. So yun, and then have there been any in their whole timeline, and in your timeline as well, Miss Maan, have there been any triggers or any significant life changes? Doesn't have to be like a big one or like a traumatic one. Any changes in your environment could be a
Kind of like
trigger.
move house or something like that.
Yeah, moving houses. Yeah, exactly. Moving houses, moving schools for your daughters. So yun. And then what are the things currently at play pa rin na, and we call those the mediators, that might be still pushing your, exacerbating the symptoms that you and your daughters are feeling. So there's so
Mm.
many things. Kasi in terms of yun nga, hormones, there are like mga biochemical and cellular molecular impairments also that we can look into based on your symptoms, based on labs as well. Tapos, once we figure those out, then we can provide your bodies with the cofactors that they need, or the necessary raw materials for them to be able to do all of the PTSD functions of your hormones.
Mhm. So essentially, like it would be best if they came in for a holistic medical consult, just so you
Yes.
can go through all of that and try to get to the root cause of what's
Mm-hmm.
happening.
Yeah,
Mm.
because and it's important to do that because no two people are the same. So even if you are from the same household, you have different needs, especially if different ages din kayo, you have different optimal levels in a way or different basta yun, different needs also and the factors that are at play also can be different. Yeah.
So basically, even if she has two daughters, the treatment may not exactly be the
Yeah.
same.
Yes,
Got
exactly. Yeah.
it. Mhm. So interesting, no? Like just learning more about your body, and even if you live in the same household, just because
Mm.
like different ages, different
Yeah.
experiences, you might
Yes.
need a different kind of like treatment protocol for
Yeah,
that.
exactly.
Yeah.
So I just remembered something. Just in line with the endometriosis and adenomyosis. So that's kasi a pattern of estrogen dominance,
Mm.
basically. So that's the umbrella issue, right? So that's the big pattern that we're seeing. But
Mm.
underneath that, what is causing this surge of estrogen, or why is there a lot of estrogen still going in your body and causing
Mhm.
inflammation? What are the drivers for estrogen dominance? So yeah.
Interesting. So like for since we're on the topic, right? Like obesity is also another kind of cause. It's caused by excess estrogen.
Mm.
Fibrosis is another, even breast cancer.
Mm-hmm.
Do we have a functional medicine approach to that? Like is there like a general functional medicine approach to these issues that we would kind of usually do?
Mm-hmm. So are you asking about obesity specifically, or with the in general na like hormone issues?
Kind
Well,
of
well,
kind
there.
of yeah, kind of I guess like in general.
Mm-hmm.
And then maybe we can talk about obesity as well, since a lot of us like struggle with that, yeah,
Yeah,
because of hormone issues, yeah.
yeah. So yes, so that's our main focus basically, is to get to know our patients. That's why
Mhm.
we spend a lot of time with them. Sometimes an hour to an hour and a half, and I'm guilty sometimes of extending to 2 hours.
Yeah,
Kasi nga, there's so much information,
correct.
and that we can gather from our patients, and sometimes it can be confusing, especially for our
Mhm.
patients. Kasi nga, I'm there's so much information out there, but
Mhm.
yun nga, my job is to really get into the story behind the health concern that you have, right?
Mhm.
Kasi reproductive system, I know it's just, we're just thinking about uterus, ovaries, etc.
Yeah.
But it can, it works kasi on an axis, and I think this is something that we will be talking about also later in the hour. Like, um, your thyroid can also have an effect on your ang tawag dito, reproductive system. Tapos, what else pa ba? Your liver also, your kidneys,
Yeah.
your gut, your blood vessels also. So yeah,
Mhm.
so there's so many ways we can figure out really what's happening to you. Because
Mhm.
one size does not fit all. And
Correct.
then yeah, so even if we do have the same health concern, how we got to where we are is different, and what we need to do is different also. Yeah.
So yeah, sa bagay. Pero like, is there like, for example, if it's excess estrogen, like that causes obesity, like could we say that the problem is more or less around like might be more of a gut issue, or not really, or it can we say like, oh, it's more of like a stress issue, that's what's triggering it, or is it still talaga there, it really isn't one size fits all when it comes to these symptoms?
Um, yeah, one size does not. So these are the so just some things to consider since we're talking about estrogen imbalance already. So what are the drivers to consider? So basically, there's a number. So there's
Mm.
obesity, excess fat, right? Excess
Yeah.
fat around your belly. Because if there's
Mhm.
excess fat, waste materials get stored there. And when waste materials get stored
Mhm.
there, inflammation happens. So that's one. Increased BMI. We have this, parang enzyme we call aromatase na
Yeah.
can convert other enzymes into estrogen also. So what are the drivers for that? Tapos yung inflammation, do you have any other diseases that you might have that is causing inflammation in the reproductive system also? Why is it not repairing then? Kasi maybe your immune system is also, ang tawag nito, impaired. That's
Yeah.
why it's not able to repair the damage and repair the inflammation that's inside your body.
Mm.
Any endocrine disruptors, so that can come in the form of cooking materials like yung mga non-stick pans, yung mga ganun, plastics, also
Aluminum. Yeah.
aluminum, yeah, so yung mga heavy metals that we can consider also.
Mhm.
Tapos, alcohol as well, gut dysbiosis, sometimes even caffeine, and sugar. Sugar is a big trigger and a big
Very, very
factor.
big trigger, definitely.
Yeah.
So yeah, so it
Yeah.
really isn't no. It's just interesting because like if I would go to my OBGYN and I would kind of list off like my like, oh, like these are my symptoms, this is what I have, then parang we already kind of know like what they're going to prescribe me and what it is that I need to do. So it's just interesting that from a functional medicine perspective, it's really not like that. It's really super different. The approach is super different. And it isn't just like just take a pill and see me in the next 2 weeks.
Mm-hmm. Mm-hmm. So, I mean, sometimes people still need to go on the pill, and that's
Yeah.
not something naman that we don't do anymore. Pero yun
Mm-mm.
nga, alongside, we work with, whoever your primary doctor is.
Yeah.
Kasi, okay, while you're in this pill, so we can be on this pill so we can control inflammation, but what are the other things that we can provide your
Yeah.
body so it can, help rebalance, help repair, help restore again. So
Mhm.
eventually, the intention is, for at least for most of our patients who come into Centro, is to wean them off the medications or even
Mhm.
just lower down the dose. So
Yeah.
yeah.
Interesting. So like since we're talking about estrogen, it's more, it's a lot about our hormones. And from what I've been hearing and experiencing, it's always like, oh, when it comes to women, like there are a lot of like hormonal issues, hormonal like imbalances. Usually thyroid, our adrenals, or again
Mhm.
like excess estrogen. What are the common hormone imbalances that women go through that you kind of see at Central?
A lot of them are very stressed.
Mm.
So cortisol is, like, very, very high.
Mm-hmm.
Tapos thyroid issues. So a lot of them are tired. A lot of them are
Yeah.
exhausted. So that can be tied to a thyroid issue or maybe cortisol issue as well.
Mm-hmm.
Tapos, what else pa ba? Symptoms wise, difficulty sleeping, difficulty maintaining sleep, and that's very crucial kasi that's the time when a lot of your hormones, yung 12 to 6 a.m. or 12 to 4 a.m., that's the peak time
Mm-hmm.
of release of a lot of our hormones and actually other reparative cells also, like the WBCs, etc. So
Got
if
it.
you're not, yeah, so if you're not getting that, it's gonna be a vicious cycle as well.
Mm-hmm.
Tapos, what else about? A lot of our women patients are also constipated, and that's an issue for detoxification as well.
Got it.
Um, yeah, yeah, quite a number of of symptoms and
Yeah.
hormonal issues. But
Mm.
sometimes kasi, so this is the thing. So sometimes they feel na it's their hormones, but really, and then we find out maybe later on that okay, so they're just sensitive to one kind of food or they're intolerant to one kind of food.
Mm.
Um, that's why they're having migraines, they're having headaches, etc. Could be gut dysbiosis also. Ano ba? So there's so many things. So basically,
Yeah.
the point is there's so many things that we can correct and bring
Mm.
back to balance. So
Yeah.
yeah, so you're not feeling all of these symptoms.
That makes sense. Okay, we have a question here from Disappear on YouTube. He says, my wife suffers from headaches and it coincides with her menstrual cycle. How
Mm.
can she get relief from that?
Okay, so yeah, okay, a lot of things. Again, what are the factors in her life that are parang at play also? But generally, kasi diba, headaches is one symptom of premenstrual PMS symptom basically.
Mm-hmm.
And that can also be, and PMS, the severity of it also is a pattern of estrogen dominance or hormonal imbalance also. So it's not
Got
necessarily normal that we get cramps or we get
Yeah. It shouldn't be
um
normal.
sorry.
It
Yeah, it
shouldn't
shouldn't
be
be.
normal.
Yeah, it shouldn't be normal. So, yun, is she, okay, she eats healthy and doesn't take birth control pills. How is her sleep? She has good general health. Okay, so maybe there's, mga, biochemical imbalances. Kasi yun nga, what are the cofactors kasi? Is she absorbing the nutrients that she is putting in her body? Kasi even though, I do get a lot of patients who, um, are eating on the healthier side, but they're
Mm-hmm.
not absorbing all of the nutrients that they are
Yeah.
putting in their body. So that's also an issue. That's maybe one reason. Again, I don't want to generalize kasi nga, we have to consider all of the factors in each patient's lives. But yeah, so are she getting enough vitamins, minerals? Is she absorbing them? Is she breaking them down well in
Mm-hmm.
her gut? Because if it's not broken down well, then it's not going to be absorbed properly. So it's not going to be able to circulate in your body properly as
Yeah.
well. So yun, what she can do, maybe she can try. If she hasn't, she can try turmeric. Turmeric and magnesium. So turmeric
Mm-hmm.
is a good anti-inflammatory. It's one of the potent inflammatories that we have. Tapos magnesium as well. It can help relax the contraction of
Mm-hmm.
her, of the muscles in her body, and can help also dilate blood vessels. So that can help ease the headaches also.
Yeah.
Yeah, so those are the things she can try.
Yeah. So I hope that helps.
Yeah, I hope that helps.
Yeah, with menstruating is really a tricky thing, though. Like for me, whenever I get my periods, it's like I would get the worst stomach cramps, like menstrual
Mm-hmm.
cramps, and that would usually last me at least a day or two. And
Yeah.
before, I would like pop a pill, so I wouldn't feel the symptoms. And then I realized, after working with you guys, just how bad it was for my gut microbiome, that every month I was like popping in a pill to suppress the feelings of the cramping.
Mm-hmm.
But yeah, essentially I was like killing my gut microbiome. And then when I went on a no sugar diet, that actually like completely took out the cramps during that month. That was so, that might be something that he might want to
Yeah.
look into as well.
Yep.
Taking sugar out of your diet really solves a lot of problems, let me tell you.
Yep. It's very kasi. It's one of very inflammatory kasi. It's just not to say na you can avoid sugar forever. Um, I still
Yeah.
I still like my sweets every now and then. Pero kasi you have to build a good foundation para your body knows
Mhm.
exactly what friend is and what foe is, right?
God. Yeah.
So you might feel off, like just I don't know for you, Kathy, like when you eliminated sugar and then you took it back in, or you just had another maybe pastry or like taste of it. Like, did you feel
Yeah.
any different symptoms?
I would get that. I would get a slight headache, and
Mm,
the pastry is like super sweet. So before it
mm,
would just be like, oh, this is okay,
yeah,
but now it's kind of like after a few, like, a few bites, I'm like, I'm good. This is way too sweet for me. So I think my entire palate has changed. This
changes. Yes.
says, Yeah, Disappear says, I appreciate your help and also understand what you told me. Disappear, I think the best way as well is to have your wife come in for a holistic medical consult. So, we have centers in Quezon City, Alabang, and Pasig. And if you're not from the area, you could schedule a teleconsult as well with Doc Ven, and she should be able
Mm-hmm.
to help your wife out. So
Yeah,
I hope that helps.
I hope that helps. Siguro one
Yeah.
comment lang because I saw that she commented na sorry, he commented that his wife is vegetarian. So you have to consider also where she's getting her proteins from because we need
Mm,
a lot of amino acids also to power the cycles in our bodies, like your energy cycle, detox cycle, and those are kasi crucial for hormone production as well. So yeah, just visit us if you have time. Oh, Canada. Oh, okay. We can do teleconsult all like now because it's pandemic, so we also do that. Yeah.
yeah. So we have access is there. No worries.
Yeah.
Okay, moving on to I guess the most obvious women's health issues because this is the one that we're being bombarded with as well at hospitals. Ovary function, like is that a thing? Ovary function. So I hear we get a lot of client patients who have PCOS,
Mm-hmm.
APAS. Um, we like there are a lot of women who come in for actually acupuncture sessions
Yep.
for
Yep.
for these. Now, can you kind of explain how that helps these symptoms doing regular acupuncture?
Mm. Yeah, so it's one of the tools that we use in the clinic, and it's been very effective so far for our patients who
Mm,
have PCOS or who have dysmenorrhea, pain problems, fertility. Also, we've ushered a few women towards healthy pregnancies. So basically, what it is we're trying to bring back balance in your body. It's one
mm-hmm.
way kasi 'di ba there's for any kind of disease in the traditional Chinese medicine perspective, there might be some deficiencies and excesses or stagnation in the body.
Mm,
So what acupuncture tries to do is to stimulate lang those areas in our body that might be lacking in one thing or in excess of one thing. So we're just like maybe turning down the dial or up the dial in some areas and
mhm.
clearing the way for energy and circulation also. So
Yeah.
yeah, a lot of our patients come in for sleep issues, for mga gut issues, ganyan. And
Mm-mm.
when they do go in regularly, they do notice a difference na rin.
And like a lot of fertility issues, like I would hear a lot of, yeah, like women who have like PCOS that they feel like they're kind of stuck with this, it's not
Mm-hmm.
treatable. And they come in for acupuncture sessions, and I'm guessing a complete lifestyle change as
Yes.
well.
Yes.
And
Yeah.
then like they're pregnant like a couple of months later. It's pretty amazing.
Yeah.
um yeah, but I think the major point there is that they do undergo a lifestyle change.
Yeah.
It isn't just this magic, oh, I'll come in for acupuncture twice a week and
Yes.
expect like miracles to happen in my life. It really isn't like that. No?
Yeah. Yeah. There's you gotta do the work as well.
Yeah.
Yeah. It's one tool that we use, but kasi there are other factors that you have to address when you go outside of the clinic or when you go outside of acupuncture, right?
Mm-mm.
So yeah, so it's lang, parang we have to work together in terms of correcting all of these imbalances. Kasi okay, you go to acupuncture but you're still eating poorly or not
Mm.
getting enough nutrients, you're
Yeah.
still not moving, etc. So yung mga ganun. Yeah.
Yeah. So like talking about pregnancy, like pregnancy I think is another like major hormonal change for women, and it's something that we don't really talk about that
Mm-hmm.
much. So, like we hear about women giving, like they love being pregnant, all the happy hormones are there. And then they give birth, and then then they undergo recovery after pregnancy, and a lot
Mm-hmm.
of women suffer from like postpartum issues. So
Mm-hmm.
is there any way that we can kind of help relieve or switch that
Mm-hmm.
around, or
Yeah.
hmm.
Yeah. So, ano kasi, 'di ba, for pregnancy, that's another transitionary phase, right? That's a change in your physiology kasi you're sharing your body with another human being, right?
Yeah.
So your requirements during pregnancy will differ when you're not pregnant kasi you're providing for two people.
Yeah.
Now, when you give birth, so that's another change kasi you're still sharing in a way your nutrients kasi you'll be breastfeeding ganyan, but at the same time your body also requires different amounts of those nutrients kasi iba na ulit siya. It's trying to correct back into a non-pregnant state. Yeah.
Mm.
So, and then we have to consider also like moms are puyat all the time, new moms, right? So they're not getting enough sleep.
Mm.
They're not able to eat on time sometimes also. So those factors then. And then parang we have to think about, okay, what can I do to help my, this mom ease
Yeah.
into that parang pre baby na phase ulit. Oo.
Mm.
Yeah, right?
Yeah.
Kasi yun nga. I hope I answered your question.
Yeah.
Basically yun nga. For postpartum, it's sometimes it's lack of nutrients din kasi. Oo.
Yeah.
And then is she getting support also? So we have to think about that center of the matrix
Mm.
that we talk about in the clinic. Like, does she have support? Is she able to take breaks? Is she able to sleep or take naps for herself? Is someone
Mm.
helping her? So yung mga factors na ganun, it's not just all parang just the physiology of it. We have to consider also the mental, emotional aspect of it. Yeah.
Yeah. That makes sense, because like your hormones are all over the place trying to adjust, readjust. I had a baby, now I don't. And
Mm-hmm.
then you have like the mental, emotional stress of basically your entire routine is now
Mm-hmm.
ruined, and your
Yeah.
routine revolves around the baby.
Right.
Um, and then yeah, like what kind of support system would you have? So yeah, that
Mm-hmm.
that I think that clears that up, because I feel like a lot of the time, when we talk about postpartum depression, it's kind of like, oh, it's just a phase, like the mom will
Yeah.
phase out of it eventually.
Mm-hmm.
um and we don't really kind of really look to see like what is happening, or at least try to understand what this new mom is going through, or even if this is like your second, third, fourth time around,
Exactly.
like what it's going through. Kasi diba, some would say, no, when I had my first baby, I was completely fine. But
Right.
now
Yeah.
that I've had my second, I'm suffering from postpartum depression.
Mm-hmm.
And I don't understand why this is happening to me, etc.
Mm-hmm.
Parang we feel like it's like something that only a couple of moms go through.
Mm.
It's kind of like roll of the dice. Either you get it or you don't. And if you don't, good.
Mm-hmm.
If you do, then it will eventually pass. So I think
Yeah.
you explaining it in that way sheds a lot more light on like how we can be more supportive
Yeah.
towards towards moms, and for moms that do have new babies, also kind of help them understand that, okay, I'm not going crazy.
Mm-hmm.
It's like there is this imbalance that's
Yeah.
happening in my body, and I'm not getting
Yeah.
maybe enough support outside as well.
Yeah. So any, just to add to that,
Mm.
any symptom that you feel is a clue already for us. So it's not just, sometimes kasi when we think that it's something emotional, it's all in our heads, but sometimes
Mm.
it can be in our gut. Sometimes it's because our thyroids aren't
Right.
working properly.
Yeah.
Sometimes, parang like it's anxiety, ganyan. So, but
Mm.
anxiety is not always in our head. So There's
Yeah.
something going on, and we have to look into the reasons behind those, either anxieties or depression or any other emotional um, issue that we have then. Yun.
Mm.
Yeah.
So basically, like, that's what you want to look out for if you're,
Mm-hmm.
if you have a new baby
Mm-hmm.
and you feel that you might be spiraling into postpartum depression.
Yeah. Yeah.
Yeah.
So ano lang, I know it's parang it's also difficult then to parang address that in a way kasi nga you're doing so many things already as a new mom,
Yeah.
right? But parang we have to figure out ways what are like how to support them. Maybe it's like giving this mom, if she has that like 5 minutes na she has for herself, maybe we
Yeah.
can give her a smoothie that has all of the nutrients that she needs, right?
Mm.
Or maybe I don't know, hiring help if it's at all possible for some of the moms.
Mm-mm.
Because you also need self-care, basically. I know
Yeah.
we've been talking about nutrients, detoxification, physiology, biology, but et cetera. But you know, and I know this might be difficult for a lot of moms also, but we need to take care of ourselves then before we
Yeah.
can take care of others, right?
Mm.
So yeah, that's where you come in, Kathy. So something
Yeah.
that you can right? You can help new moms with, or expecting moms also, because it's a new phase of their lives. And some of them, even
Really.
though they're happy that they're pregnant, there's also some worries also, diba? Parang, am I gonna be
Yeah.
a good mom? Am I gonna be,
Mm.
able to take care of everyone? So yeah.
Correct. And that tends to increase like when the baby is there. So yeah,
Yes.
definitely. Also, like, learning to ask for help, because a
Yes.
lot of us, that's the biggest problem. Like, honestly, if we only learned how to, like, that, asking for help is okay,
Mm-hmm.
um, and being vulnerable, is completely fine.
Yep.
I think, that would lessen a lot of, like, the mental load that we
Yep.
kind of have in our head.
Yep.
What about recovery after pregnancy? Like, is there anything that we kind of do differently, like in this functional medicine perspective for new moms that maybe you can talk about?
Mm, Again, since you are transitioning out of pregnancy, it's going to be a new phase, especially for those first 3 to 6 months, right? So so many things also. So everything that we talked about na rin, like managing your sleep, managing exercise. I know paulit-ulit ako ba kasi doon talaga umiikot lahat ng
That's the routine. Yeah.
those are this is where we can find at least
Yeah.
the most common na root causes in terms
Mm.
of your any imbalances in your life. What else pa ba? Maybe kasi a lot of us, 'di ba, parang we have cravings, right? So we have to parang take note of those cravings also. So some of us, and again, pag stressed ang tao kasi, and I'm also talking about new moms since this is a
Mm.
stressful phase for them, right? It's not naman stressful, not traumatizing, but it's causing imbalance in their body. And
Exactly.
sometimes they come in and they say, "Oh, I'm craving more salt than usual," and that to me is already a sign of
Mm.
a cortisol excess in the body, or adrenal impairment na rin. And for some, "Oh, I'm craving more sugar now." Yes, because your body needs energy, or is asking for more energy. So what's the quickest way to get energy, right? So it's sugar. But then
That makes
sugar
sense.
naman creates inflammation and
Yeah.
then exacerbates your hormonal issues. Ganyan. So what are the
Mm.
things lang?
Oh,
What are the things like that we can provide? So like
yeah.
ito, general ano lang siya. So a lot of color, a lot of good fats, a lot of ano pa ba? Like green leafies, ganyan,
Mm.
protein sources,
Yeah.
for the amino acids, etc. So
Yeah.
yes.
Interesting. Like, kasi, like, we talk about a lot about, like, oh, parang san ka ba pinaglihi, etc.
Yeah.
You know what I mean? Like, that's part of the
Mhm.
conversation.
Yeah.
And now that I think about it, it's like, that's interesting. So that also kind of shows you, like, what your mom was kind of going through when
Yes.
she was pregnant with you. Like, was it sweet? Was it salty? Like, I don't know.
Yes.
Pinaglihi mo kasing kama. So what does that mean?
You know what? you know what? In ano ha,
Mhm.
I can't remember lang the specific month in utero, but
Mhm.
baby develops his or her palate at a certain month.
Oh
So
wow.
it's very crucial what you eat when you are pregnant, kasi
Ah,
that will determine what baby will be into food wise, nutrition wise when grows up, when he or she grows up. So that's
very
interesting, right? And yeah,
yeah.
never thought
It is.
about that.
I'm kind of like if the moms keep complaining about how their babies are picky eaters, then maybe what were you guys eating when you were pregnant with the baby?
And that's science based ha. That's like one of the lectures that my one of my mentors taught me, also si Doc Oyi. So yun,
That is so
so many
cool.
things. And even since we're talking about pregnancy, I think it's also important for us to discuss this lang briefly.
Mhm.
Your nutritional requirements for the first trimester, second trimester, and third trimester are very different. Yes,
Hmm.
yes. So the amount, the necessary specific na amino acids, specific na macro and micronutrients.
Mhm.
Yeah, it differs. And now we're calling the pre-pregnancy stage as trimester zero.
So
Kasi
like before you even get pregnant. Okay.
yes, yeah, because you have to parang pregnancy doesn't just start there. It starts tama naman eh. When I heard that, I'm
Yeah.
like, oo nga no, kasi you have to have a good solid foundation because you're gonna be
Yeah.
welcoming in a baby. So yung house dapat ni baby is working optimally.
Yeah,
Yeah.
exactly. That makes sense. Yeah.
Mm-hmm.
Never thought about it like that. Doc Sasa says asking help is very important. It's not a sign of weakness. For moms, never do everything on your own.
Yeah.
Exactly.
Yep.
First, I don't
Yep.
know. Like, I think it's just so ingrained because in us, they were like, oh, we don't want to bother anybody. Let's not,
Yeah.
uh, you know, don't want to come off as too needy. But no, like, definitely ask for help,
Yep.
especially when you're going through something that you
Yeah.
know that you can't handle alone. Doc
Exactly.
Sasa also says never ignore any symptom too.
Yep.
Yeah. So
Yeah.
especially like, if you work closely with your OBGYN, with your doctor, with your doula, whatever it is that
Mm-hmm.
whoever
Mm-hmm.
you want to work with, um, let them in on what's happening with you. Stop saying that everything is okay. Because yeah,
Yes.
even the littlest things, right? Like you said, like the change of diet, like that you like that, if somebody likes more salty food now compared to sweet food now, that makes a difference to your
Mm-hmm.
functional medicine doctor.
Mm-hmm.
That might mean something for like your doula or whoever it is that you're working with.
Mm-hmm.
um so yeah, that's just pretty amazing, like what, especially kind of thinking about like what our bodies go through
Yep.
to accommodate new life,
Yep. Yes.
right?
Oh. Yeah.
And it's also kind of crazy just how all over the place our hormones are like throughout our lifetime, you
Yeah.
know
So what my teachers have taught me and what my mentor keeps hammering on me is that it's a symphony. Our hormones are a symphony. They
Mhm.
need to be working in tandem with each other. And then if there's
Yeah,
like a broken instrument, right, it's going to ruin the whole orchestra na. And that makes
yeah,
sense. Yeah.
yeah.
So even if you are presenting with kung wari, yun nga, a thyroid issue for now, kasi yun yung nakikita sa labs,
Mm,
eventually you are gonna present with something else later on. Hindi pa lang siya nag-appear there, or parang um, ang tawag nito, hindi pa siya nagma-manifest, but you are going to be at risk because you
yeah.
do have this issue already.
Mm. Interesting. Is it the same but for men? Because if parang for men is like, like they hit puberty, then they kind of go into andropause na from there, right? And then it's just a very slow kind of experience for them. Not like us when we go through menopause, we feel it.
Yeah. Oo. Different din naman yung requirements for men. So yung testosterone nila, are they ganun din,
Yeah.
PTSD, are they producing enough? Why do they have low testosterone? Kasi for some, they can experience low testosterone then at a younger age. I think there's
Mm,
increasing numbers of that. And also kasi it's not just testosterone that men have. Ano rin, they also have estrogen, they also have progesterone. So that was need to be in balance also. And for us then, we have testosterone lang din.
correct.
So kailangan ano lang siya, hindi in excess, hindi kulang din. Yun.
Mm-mm. It's where a lot of problems happen.
Yeah.
So,
Yep.
well, before we end this, can we talk about menopause a little bit? Because there is so much happening when we hit menopause, right?
Mm-hmm.
You hear about the hot flashes, you hear about the what do you call this? Like the mood swing.
Swings. Yeah.
I have like titas in the US who just kind of, I think they underwent a hysterectomy just so they wouldn't have to experience the hot flashes and all of that.
Mm-hmm.
I didn't even know that was an option. Just like, oh, I don't want to experience menopause. Can you like get rid of it now? I'm good.
That's like a multifactorial na ano rin um issue also.
That
Um,
sounds nuts to me, but apparently it's something that
kasi
they do now. So
Kasi there's still parang you're still secreting hormones somehow. It's just again
Mhm.
at a different phase of your life. So your requirements are going to be different.
Yeah.
And you're transitioning out of that stage of fertility. So it makes sense then na medyo nag-haywire din yung iba. But as long as
Mhm.
there is support underneath the hood of your car, then there are women who have experienced less symptoms or have transitioned into menopause a little bit more uh,
Easily.
easily. I was gonna say gracefully, or I wanted to watch my words. Yeah, and then sometimes din kasi pwede rin na ano yun, there are things that we can do also to ease that, like acupuncture,
Mm.
taking of some specific nutrients to ease the women out of like hot flashes, the headaches
Mm.
and sleep issues, ganyan. And sometimes also you need ano rin, ano yun? Hormonal replacement therapy, but
Yeah.
hindi siya ano kasi one size fits all. So if you do go that route, um, it needs to be really specific for your body kasi you're bringing
Mhm.
in a hormone that's coming from outside your body, right? So it's an
Yeah.
exogenous hormone. So again, you have to consider it's very complicated. Most of my the consultants I know, I just leave it up to them kasi
Yeah.
it's complicated. Hindi lang siya just taking parang
Yeah.
hormones lang.
So it's super specific talaga.
Yeah.
Is there any lifestyle change that would help that transition?
Exercise.
Okay.
Yes. Exercise, getting good sleep, getting out there, getting sun, getting vitamin D.
Mm.
Actually, tapos, kasi vitamin D is involved in your hormones as well. There are studies na rin, or parang there's like a shift na they're calling it the pre-hormone, like another hormone.
Okay.
So it builds also hormones, and it also has an effect on your immune system as well. So yeah, getting sun, moving,
Mm.
ano ba? Kasi like if you're not moving, you're gonna have increased fat around your belly, and that can cause
Yeah.
inflammation. Also, that can cause insulin resistance, and then slew of other symptoms as well.
Mm.
What else pa ba? Eating the colors of the rainbow. I know that's pretty something that we commonly say, but take
Commonly
your
say, but not commonly do. Let's
That's
be
true.
honest.
That's true. That's true. I know I'm also guilty of it sometimes or most of the time. But yeah, try to increase more color also. Whether you're going through menopause, perimenopause, or any other hormonal issues. Kasi
Mm.
those are the phytonutrients that can rebuild the foundation that you have. So
Yeah.
yeah.
Yeah. Interesting. So what I'm getting from this is basically a woman's entire life cycle really is, as you mentioned, like a symphony of hormones going up and down depending
Mm-hmm.
on where we are in life and what's
Mm-hmm.
happening,
Yeah.
whether we choose to be moms or not, and then eventually when we have to close up that fertility shop with menopause, it's a whole new, parang like they're like little like new adventures that kind of
Mm-hmm.
happen throughout our
Yeah.
lives,
Yep.
and it's really up to us to manage it by basically just making better choices and living a better lifestyle.
Yep.
Um, and it's also interesting that a lot of, again, like, yes, we are predestined for to have, let's say, the obesity gene or the gene for that causes PCOS or whatever it
Mm-hmm.
is, but we're still in control of whether or not it comes out
Yep.
based on the lifestyles that we're leading. So it really
Mm-hmm.
is a choice and really relearning a lot of the things that we kind of grew up and considered to be normal.
Yep, exactly, exactly. So hit the head on the nail on that, Kathy. So that was a good summary of all the things we
Mhm.
talked about. Yeah.
So really, if anybody is going through any women's health issues, what would be your advice for them?
Uh, Number one, don't ignore your symptoms, like what Doc Sasa said, right? So if you're feeling off, there's probably something going on underneath, right?
Mm,
So it's better to address it early than later, kasi kuwari you want to get pregnant, right? You have to start early. You have to address all of the imbalances, address
yeah.
whatever hormonal issues you might have, whatever symptoms you might be feeling. Tapos, what else ba? Yeah, just always consult a doctor, whether it be through us or like your OB or any other doctor. So you
Mhm.
can get started lang in addressing all of these health concerns. I know kasi for us Filipinos, parang tiisin natin hanggat hindi na kaya.
Yeah.
Pero pero kasi parang 'pag hindi mo na kaya, parang ang dami na nangyayari. So,
Oo.
oo. So, yeah, so it's better to talk to us now, talk to your doctors early on. Para you have a game plan, right?
Oo.
Kasi we do have more control than we think. And
Mm-mm.
then what else pa ba? Yeah, and then try to move as much as you can. I know we're still pandemic and movement is still limited, but try to go on a walk or just have a minute to yourself to just breathe. Matatapos din to.
Yeah.
So, yeah.
Stretch. And I think one of the unique things about Centro also, and having you guys as Centro doctors there, is you don't even have to have a symptom.
Mhm.
When you come into the Central Holistical Clinics, you can actually go in with a goal. Like, for
Mhm.
example, I plan on getting pregnant,
Yep.
within the year.
Mhm.
What is it that I need to do so that my body is in that optimal, the optimal position for me to get pregnant? What do I need to change,
Yep.
etc.? I
Mhm.
think changing that relationship, also the doctor-patient relationship of papasok lang ako pag malala na at napakadami ko ng
Yeah.
simptomas,
Yeah.
versus, oh, this is I'm pretty healthy. I just need to know how to be healthier because this is what I plan on doing in the
Yeah.
future. Totally changes the
Mhm.
way that you look at the relationship and the way that you look at wellness as well, no?
Yes, exactly. So we don't just manage diseases, we also manage your health.
Yeah, they actually prefer that you come in healthy na.
Yeah.
Just because it's easier to work with that, diba? It's easier to start from zero than like from -10 to work to zero
Sometimes.
to work
Sometimes.
to whatever
Right.
it is. Yeah.
Yeah, yeah, yeah. Oh, so yeah, so that's something that we can guide our patients through also. Parang, okay, what are what can we improve on basically
Yeah,
if you are on this path of
exactly.
doing a lot of things for your body already. Yeah.
Yeah. So that is an option. So please,
Yes.
guys, invest in your health as
Yep.
early as wala pa kayo nararamdaman.
Yep.
So,
Yep.
Doc
Yep.
Ben, for anybody who wants to get in touch with you to kind of see you for a consult, since the centers are open now, where and when can they find you?
So my clinic days are Tuesdays and Thursdays at the Grove, and then Fridays at our QC branch. So that's our newest branch. Yeah, please visit us. We're open from 10 a.m. onwards. Just call the clinic to schedule an appointment. And yeah, if you have any questions, we do have our Facebook page and our YouTube page and our
Mhm.
Instagram page. Yeah.
Exactly. So if you have any follow-up questions to this, just leave them in the comments and we will get to them as soon as we can. So
Yeah.
yeah, that's kind of it for us, Doc Ben. Thank you so much for your time.
Thank
Do
you.
enjoy your Mother's Day as the rest of you guys as well. And we will see you again next weekend. Yeah, bye for now.
Thank you.
Ciao.